And I'm very concerned about the report that the city issued. I found that there's numerous omissions. Hydrofluorosilicic acid is an extremely dangerous and deadly chemical that's used in Austin. There was no mention, for example, of the material safety data sheets of how dangerous this chemical is. Number two is the fact that hydrofluorosilicic acid is also one of the most dangerous chemicals transported in Austin if there were to be a serious accident and a breaching of the container on the highway or the city streets. And a lot of people don't know the hazards associated with a spill and a breaching of one of these tankers that goes right through the city of Austin and to the treatment plants. The chemical used in the artificial water fluoridation by the city of Austin contains other toxic chemicals such as lead, mercury, cadmium, and arsenic. We don't even know all the chemicals that are in it. So this is not a single chemical. It's a smorgasbord, a toxic cocktail. Artificial water fluoridation chemical used by Austin is classified by the Environmental Protection Agency as a hazardous waste. Why would anybody want to put a toxic hazardous waste from industrial manufacturing plants in the drinking water supply?
Now, Doctor, you like the CDC website. I like that website, too. It tells us a lot of good stuff. One of them is that we get fluoride for our water from a very clever source, which is a co-product of the phosphate industry. Now, that's a byproduct of the phosphate industry, which we know is toxic. They can't dispose of it in normal ways. Doctor, would you knowingly consume a toxic substance that is too toxic to be thrown away in a trash can?
Well, I would not knowingly consume something that I know is going to be toxic to me. So.
Wonderful. Looking at the CDC's website, I don't want to use fluoridated water for formula. Should I be required to purchase bottles of water for my children's health, not to mention my wife and my own health?
Again, in terms of your being required to do anything, it would be your choice. And again, it sounds, there is information about that. As you're purchasing your formula, I suppose you would purchase whatever else you need to make the formula appropriate.
But I'm trying to follow the CDC's recommendation. They say don't give fluoridated water to infants. That's what I'm trying to do. It's very expensive, especially for the lower class, who we say this benefits. You said that, right? This benefits the lower class more?
Well, I think the point was that it is a method that gets that social equity in terms of the benefits on dental caries, so that the populations aren't having to buy toothpaste. So that the populations aren't having to buy toothpaste. The populations aren't having to buy toothpaste.
Dr. Huang brought up the subject of social equity, and since he did, I would like to call to your attention this rare and hard-to-get report of the Texas Dental Association, December 2008, so recent, and in it they talk about the endemic tooth problems, decay, and other poor oral health among low-income people in Texas specifically. It's based on the 2000 Surgeon General's report for the whole country, which says the same thing. Fluoride is not doing anything to help low-income people's teeth. That is a myth.
Robert Carlton, Ph.D., a former EPA scientist, said, "Fluoridation is the greatest case of scientific fraud of this century." William Marcus, Ph.D., senior EPA toxicologist, said, "Regarding fluoridation, the EPA should act immediately to protect the public, not just on the cancer data, but on the evidence of bone fractures, arthritis, mutagenicity, and other effects." And EPA headquarters has completely banned fluoride from its building, not even in the wastewater. They will not let any fluoride into their building. Dr. Blaylock, neurosurgeon, says, as it stands, there is in fact no credible evidence that fluoride added to the water supply reduces cavity rates at all, and several studies have convincingly demonstrated that the incidence of cavities is actually higher in fluoridated areas. Dr. Wolfgang Klein demonstrated that cells exposed to 1 part per million fluoride exhibit a 50% reduction in DNA repair enzyme activity. And if the DNA damage is in the reproductive cells, it transfers to children. We're transferring DNA damage to children by putting 1 part per million fluoride in the water.
1 milliliter of toothpaste would be a really big glob of toothpaste. I think it's about twice as much as you'd use. And that would be about as much fluoride as is in 2 of these water bottles of Austin City water. So if you're not comfortable eating a big dose of toothpaste, you shouldn't be comfortable drinking about twice this much Austin tap water.
Hello, I'm Dr. Bill Osmondson. I'm a general and cosmetic dentist and have been a dentist for 30 years. Before that, I received a master's in public health in nutrition and health education. For the first 25 years of practice, I promoted water fluoridation aggressively. I thought I saw the benefits. It wasn't until I actually looked at the information myself and sat down and looked at the different government agencies and the different reports and the studies that I began to realize that fluoridation was a problem. One of the first things I did is I looked at my tube of toothpaste. It says drug facts. I know it's a drug. If I were to give it to you, it'd have to be a prescription. That's for swallowing. When it comes to toothpaste, it also says don't swallow. And if you do swallow, contact a poison control center. Well, the amount of fluoride that they're talking about is a pea-sized amount of fluoride. You probably don't see that in advertisements, a pea-sized amount of fluoride. Usually when I see an advertisement, it looks more like a Dairy Queen ice cream cone. That amount is 1/4 milligram of fluoride. Well, that's the same amount of fluoride as what we find in 8 ounces of water. 1/4 milligram of fluoride, 1/4 milligram of fluoride. Don't swallow. If you do, call the Poison Control Center. One of the things that concerns me is water fluoridation for infants. The American Dental Association and Center for Disease Control recommend that infants not receive water for drinking nor for making their formula. It's 250 times more concentrated in fluoride than mother's milk. We shouldn't fluoridate water and harm our most vulnerable.